Okay, well, good afternoon, everyone. Thank you for participating today. My name is Pierre Demian, Senior HR Analyst for the City of Carson. This is part of Open Enrollment. Today, we're being joined by the wonderful staff from BASIC. And we have today Mr. Dave, Mr. George, who is the BASIC representative. He's going to speak to us about the FSA, FMLA, and other services we're going to be getting through BASIC. So without any further introduction, Dave, you have the floor. It's all yours. Go ahead.
Great. Thank you, Pierre. I'm going to take some time and cover the flexible spending account first. I'll follow it by just taking a few minutes to describe the Cobra services and the FMLA services that we provide. You'll probably have a lot less contact with that than you will the FSA, but I want to make sure that I fully explain that benefit. So what is an FSA? An FSA is a tax-preferred way that you can set aside money pre-tax for certain sets of expenses. There's two buckets of money that you as a City of Carson employee are eligible to spend it on. One is called a health or medical FSA that you can spend on medical, dental, vision expenses that are out of pocket. And the secondary one is called the dependent care FSA, where you can spend money on childcare expenses for kids under the age of 13. I'm going to go more into the details of how the plans work and some of the kind of attributes of those plans. But basically, both of these fall under Section 125, where it enables you to save money again pre-tax. The benefit of that is basically, you set aside that money on a pre-tax basis. It's held in an account for you, and then it's returned to you where you can basically purchase things on a tax-free basis. So things like deductibles, co-pays, co-insurance, vision expenses, orthodontia, crowns, fillings, all those things are eligible. It's a lot of things that you have the ability to spend the money on that you're not probably, if you're not participating, that you're kind of missing out on at this point. There's really no downside to participating. So here's just a kind of a savings example. On average, the average participant's going to save between 25 and 35%. Depending on their tax bracket. So this just kind of gives a few different outliers as far as expenses. So you see a physician expense here, copays, prescription, hospital, and then some dependent care. Again, 25 to 35%. This specific demonstration shows a 27% tax bracket. But again, you do have the ability to save money here. We just want to make sure that we educate you on how these work. You do not need to be enrolled in the City of Carson benefit plan to participate. It can be expenses for you, your spouse, and any dependents that are tax dependents. And the other nice thing is basically on the medical, both you and your spouse can both participate if they are, if they have that at their employment. On the dependent care, it is capped, and we'll talk about that here in a few minutes. So the other thing to kind of think about, the expenses do have to happen during the plan year that we administer for you. So that plan year is from January 1st until December 31st of 2021, which is hard for me to think about. The maximum on the medical is $2,750. The maximum on the dependent care is $5,000. Again, you can double up with the medical. You just want to double dip and submit expenses to both places if your spouse participates. Dependent care, again, is a split. So you and your spouse, for example, could both do $2,500. The only rub from a participant standpoint on these accounts is there is a use it or lose it. So if you don't use your funds by the end of the year, they are lost. And we'll talk a little about how to plan for that and look a little bit about ways that we can make sure that doesn't happen. On the medical and on the dependent care, you have what's called the grace period. It's 2 months and 15 days into the next calendar year where you can spend down expenses. So what that means for you is basically you have until March 15th of 2022 in this plan year. So in essence, it's 14 and a half months where you can actually incur and spend money. There's not a limit on that or a cap. Basically, you have the ability, again, to spend down that money into 2022, which seems like so far away, on March 15th or so. So basically, you can incur claims up to that time. Once your 2021 balance is exhausted, the claims would then go towards your 2022 balance. If you don't have a 2021 balance, they just go straight to 2022. And same thing with dependent care. So some things that you need to know, as far as enrolling in these benefits, you have to sign up in open enrollment. You can only have a change in your election if you have a qualifying life event. From a election standpoint, let's say that you're paid monthly and you elect $1,200. The money would come out of your check pre-tax, $100 a month. So basically it's going to be equally throughout the year. The other thing with these accounts is on the medical side, the full balance is available day one. So what that means to you is if you enroll in the account January 1st and you have LASIK on February 15th, you can be reimbursed that whole amount even though you haven't contributed up to that amount yet. On the dependent care, that is a pay-as-you-go, so the money has to be taken from your account before you are reimbursed for it. So again, here's some resources as far as eligible expenses on the medical FSA. So again, medical, dental, vision copays, prescriptions, any kind of vision type of expense like frames or glasses, contact lenses are eligible, orthodontia, fillings, crowns, smoking cessation programs, diabetic supplies. There's a whole list of things. I would also encourage you to go out to a website called FSAstore.com. It'll give you a lot more information on things that are eligible as well as calculators where you can put in, your specific situation, how much you may be setting aside, how much you may be spending. It'll tell you exactly how much tax you can save and potentially how valuable the plan could be to you. As of last year with the CARES Act, they also opened up the over-the-counter with FSA. So what that means to you is that also included would be pain relief, allergy pills, cough and cold medicine, stomach remedies. This is really an easy place to spend on some money if you have it at the end of the year. Especially if you have kids, this stuff goes really fast. You can spend that. Some other things that are eligible on the health FSA would be things like thermometers, KT tape, Band-Aids, all those things are eligible. And they also added menstrual products to the list with the CARES Act. Dependent care expenses. So these again are child care expenses for kids under the age of 13. The limit here is $5,000. It also can be used for a spouse or a dependent who is physically or mentally incapable of caring for themselves. That's a tax dependent of yours. So basically, in essence, you take this election as opposed to taking the federal tax credit. But in essence, again, this is a pay-as-you-go account. So again, you're saving your tax dollars by putting the money in this account instead of spending it out of pocket. So there's a few different ways to access this money. The first way is going to be a debit card. You'll receive the card in your name that you'll be able to use for items at purchase. It'll work for both medical and dependent care. You'll have also access to a mobile app where you have the ability to picture to pay. You can see claims balances, all that kind of fun stuff. And then finally, you'll have access to an online portal where you have the ability to submit claims, check balances, see transactions, all that kind of stuff can happen on the website. The card is a smart card, so the card is going to work at like a doctor's office, an optometrist, dentist's office, as well as other places. They're going to carry eligible items like a Walmart, Walgreens, Target. Those type of places have inventory systems in place that automatically determine what's eligible. The cards are also loaded with something called MyCash. So what that is if you submit a claim to us that is what I classify as a hard copy claim, so either upload it on the phone or on the mobile app, there is a third bucket on that card called MyCash. Your claims will be paid into the MyCash account. From there, what happens is basically you have the ability to transfer that money into a bank account, whether that be checking or savings. You can cash it out in an ATM, or you can also spend it in an unrestricted level in that bucket. So again, you have the ability to get this card. It's a MasterCard. It's going to look like the white card on the right. It'll be loaded with those three buckets that we talked about. It'll also include picture to pay, where you have the ability to basically take pictures of claims, send them in, and just click submit. From there, it's classified as what's called a manual reimbursement. So basically, you're going to be looking for 5 things on those manual reimbursements. So we don't want like copies of voided checks. We don't want the 3x3 credit card receipts. We're really looking for claims that have the name of the participant, the doctor's name, the service provided, the date, and the amount. So basically, once you submit those on the app, they would go into your MyCash account, and it would be available right away. MyCash, again, just to go over that one more time, is that third bucket. It's an unrestricted post-tax reimbursement, so you have the ability to spend the money directly from the card. you have the ability to take that money and transfer it to a checking or savings account. And then finally, you can withdraw it at an ATM if you'd like to. This is just a screenshot of the app. Again, the benefit here is you have the ability to download it, request payment there, as well as see information on your accounts as well. It's also important to remember that you want to keep track of your receipts as you have them. So as you swipe that card, it's not, it's not a forever thing. You may get a request for a receipt. We're going to be looking for those 5 things that we talked about earlier. So the name of the provider, the patient's name, service, date, and the amount. We have a generally really high auto substantiation rate. But again, if you get a request for a receipt, you want to make sure you send that in. This is, again, just to share again, this is the documentation that we're looking for on that FSA. So again, the 5 items here, the disclaimer at the bottom, we don't want canceled checks, credit card receipts, or balance forward. If you have an explanation of benefits, that always works really good. And that's probably the best point there. Here's some contact information specifically for the FSA. This will get you, again, the ability to contact us if you have questions. Just to kind of synopsize again, the benefit of these accounts is to set aside money on a pre-tax basis for both medical and dependent care expenses. Typically, you're going to save between 25 and 35%. You're going to get a couple debit cards to use to spend that money, as well as access to a mobile app and customer service to be able to answer questions. If you have questions on specific items that are eligible, I would go to that FSAstore.com website, and there is an eligibility list as well there that's really nice, where you can search alpha sorted to tell what's eligible and what's not. Very quickly, I'll speak on the Cobra and the FMLA. From a Cobra perspective, you may come in contact with us just from a very cursory level. We'll send a couple different notices depending on your situation. There could be what's called a general notice that'll be sent to new employees that will inform them of their rights and responsibilities should they ever be offered Cobra. So if you're a newer employee or you're first enrolled in benefits, that may be something you receive from us. You may also receive what's called the qualifying event notice if you ever have a dependent that terms off the plan or you yourself term off the plan. We would send that notice, you would elect and pay back to us, and then we reinstate your coverage for you. We'll also be managing the FMLA for City of Carson. So what that means for you is we have the ability to basically send out the paperwork that's required for FMLA for both state and federal leave. You'll get that from us. Basically, you want to go through your same process of requesting leave from a supervisor, and then we'll get the leave paperwork directly to you. You'd send it back to us for approval or denial, and we handle the correspondence from there. There is a question in regards to debit cards. When do you receive those? So the cards come in the mail. So once we receive your enrollments for the plan, which will happen after this period where we enroll, and we have all the information we need from you guys. I know your human resources team is working on it now. Once we have everything, it's about 7 to 10 days from when we have everything that you'll get the cards. Considering your plan is, you should be up and rolling before the first of the year. You should have those cards well before the first of the year. So that you should have them in hand and be able to spend them. They won't work until the first of the year, but you will have them. With that, and I know I kind of went through a lot of different stuff there. Did anybody else have any other questions?
Yes, I have a question. Can you hear me?
Yeah, I can hear you.
For the FSA, when you're using it for prescriptions or over-the-counter medication, like the store receipt is what would be submitted for those purchases?
Yep.
Okay.
You just wouldn't want to, that like little 3x3 credit card receipt that it punches out sometimes.
Oh, right. Yeah, because
you don't want to send that one, but if it's like a Walgreens receipt, if you go to Walgreens and you watch your receipts, a lot of them will have like an F on them that'll say what's eligible and what's not. But that's a really good question.
Thank you.
No problem. Anybody else with any questions?
Hi, Dave. I actually have a quick question for you.
Yeah, go ahead, Pierre.
So let's say I'm new to this too. So let's say I go grab, do a prescription glasses. I can use this account to pay for the deductible I'm going to pay, right?
Correct. Yes.
Okay. Now, if let's say, so if I do get my glasses, there's actually like really no limit on except for the amount I put in there, right?
Correct. So the cards are smart in the fact that they're only going to work at, depending on the merchant code here, they're only going to work at certain places. So it's not going to work at like a Best Buy or a Dick's Sporting Goods. But the card will know basically the limit on the medical FSA will be whatever your election is. But it's smart enough to know only to pay up to that amount that you have set aside. But yes, you would use that card to pay for the expenses. Or if you paid out of pocket, say that you didn't have your card or you forgot or whatever, you could take a picture of the receipt and get reimbursed that way.
Okay. So let's say, yeah. Okay. Let me ask you another question. If I go ahead and let's say again, like grab glasses or grab something, and I don't have the full amount in the account, let's say I have 500 right now and the cost is 1,000. Can I wait till I have the full 1,000 in there to submit the reimbursement, or can I do it as it comes along?
So the only one that's pay as you go, Pierre, is that dependent care. So you're going to have access to that full whatever you set aside right away. On dependent care, if you submit a claim for, let's just say $1,000 and there's only $250 in your account, it's going to pay the $250 and it's going to pen to that other $750 until you have the money taken out of your check.
Okay, but if let's say it's the same way around and it's for me, not for my dependent, for the primary person, they would just pay the $250 and that's it, right?
Correct.
Okay, all right. Well, thank you. That concludes my questions.
Yep, and there was a question. Somebody else made a comment. They use their card for contacts, glasses, dental appointments, Kaiser, Target. They just wanted to make sure that everybody knew.
Can you hear me?
I can.
Hi, Dave.
Hey, how are you?
I'm well, thank you. I'm a big proponent, I guess, for FSA and for the FSA program, and I love it. So Pierre, on day one, your card, if you selected $27.50 for the year, your card is valued at $27.50. On that day, you can make an appointment to get your LASIK eye surgery and swipe your card for the full value. So I love it. When I'm feeling down and out and broke, I go, oh, duh, FSA card to the rescue. That was my testimony. Oh, no, and when you said, like, if you go to Kaiser and you swipe your card, everything that was in your cart that's eligible will be charged to the card. If it's not eligible, like toilet paper, well, I don't know, is toilet paper covered? Mascara, per se.
Right.
Everything else will be charged to the FSA card except for your mascara and your wine.
Correct.
I love it.
Yep, it's a really good account. I think there's a general misconception that people think they have to spend extra money to do this. I think, to your point, if they stopped and looked at the expenses and did some education, they're actually already spending the money on things like Band-Aids and sunscreen. And there's a lot of things that we buy on a daily basis that are eligible that you don't even think about. Definitely check out that website, talk to HR. If there's other questions that pop up either after this session or after this video, we're happy to get those answered and really, we just want people to participate, and it's a great plan for everybody.
Question for dependent care. Is that eligible for tuition? Like say I have a child here at the city's preschool, so there's tuition payment. Is that possible to be used?
So preschool would be eligible, yes.
Okay.
But if it was like regular school, it would not be.
Got it.
Good question. Anybody else have any other questions?
Okay, I don't see any questions. Griselle, did you receive any questions?
Hi, Pierre. Let me see here. No, I don't have any questions. I didn't receive any questions.
I've been checking the chat too, and I don't have anything on my end.
No.
Okay. All right. Well, in that case, since we don't have any more questions, Dave, Rick, thank you guys for this wonderful presentation. It's a lot of
Thank
good
you.
information. And again, contact information is available here in the last slide. And this recording is going to be posted to the city's website within the next 2 business days. And on behalf of the City of Carson Human Resource and Risk Management Department team, we'd like to thank you again for your assistance with this. All right. Okay. Well, have a
Thanks, everybody.
good day, everyone.
Have a great day, everybody.
Thank you.
Thank you again. Bye-bye.